The U.S. has the largest healthcare system in the world. The U.S. is also becoming one of the most diverse places in the world. The issue of interpreters in healthcare is becoming more significant.
Interpreter services is a growing field in the healthcare in the U.S. Because of the influx of new immigrants and refugees and other people from abroad who don't speak English as their first language, and also because we are, as a society and as healthcare systems, more attuned, or getting more attuned into their needs and into the importance of communicating really well with our patients. So those two forces kind of combined and created a really strong rise in interpreter services in hospitals in general. Certainly here in the metro area in Minnesota, we are a little bit of an example nationally.
By the year 2050, the amount of immigrants and refugees in the U.S. will be equal to the rest of the population.
One fact is that we cannot escape that this, our community is becoming so diverse. Either we like it or not, and we start to say, oh, maybe we need to think about it now instead of waiting for some problem to come. Then you said, why is that we are not effective, or why is that it has been harmful to some patient because we did not know exactly that patient.
You have a cultural problem, and then you have a financial problem. Okay, and is there a need for interpreters? Absolutely. Now let's take the cultural problem. Like I said, if they're pointing to their head and they're in pain, is it a CAT scan that's needed, or is it an aspirin? We don't know, because there's a language barrier. Mm-hmm. So now let's take the financial end of it. So if somebody that can't speak English, does make it to the emergency room, what happens? Well, that is going to be an expensive trip to the emergency room if that person only needs an aspirin. If the doctor doesn't know and does a CAT scan, they do it needlessly. Is it needless? I don't know. But if there were an interpreter there to say, oh, there's a pain in this person, she must have a headache, and the person conveys a headache, or has migraines, or some pattern is brought out to the doctor, well, that's a huge savings.
Money and lives can be saved by overcoming linguistic and cultural barriers.
Language is one big barrier. The language is a huge barrier in terms of access of services. But I think during the past few years, some clinics and hospitals are doing better.
The most common languages that we interpret in our department daily are Somali, Spanish, Hmong, Vietnamese, Mandarin, and hearing impaired. The patient comes to the hospital wanting to be treated of the concerns or the symptoms that he or she may have, while on the other side, a provider would like to give the best care that he can give to his patient. And the only way to do that is to have a good communication between the provider and the patient.
Yep, I usually go and greet them when they first get there. And if I have other things to be doing, like phone calls or whatever the case may be, I'm off doing those things until they're roomed. Or if I have nothing to do, I'd maybe just sit down and play with the kids or chat with the mother or father, and accompany them to the room where they get weighed and measured and all of that good stuff, and just interpret along the way whatever anyone in the clinic says in English, I say it in Spanish to them, and vice versa, which is nice because it really makes them feel, I think, like they're really speaking to that person, even though they're speaking Spanish to someone who doesn't speak Spanish.
Probably come up with some examples of things that you can say in English that are difficult to translate into Spanish, without doing a lot of going around and talking around and trying to depict what the meaning of the concept is, and vice versa. There are things in Spanish that, that gets more pronounced with some other languages like Hmong, for example. Try to talk about depression as a concept in Hmong. There's no such a word.
If we have a provider that really is not culturally sensitive, and without knowing the cultural issues behind a person saying things that are inappropriate, for example, in front of the children, because in some family structures, the hierarchical order is so important. Certain things you shouldn't say in front of the children. For just an example, you should not address to the patient, but you should address to the person in authority. But in our system here, we talk directly to the patient. And we want the patient to know, like, you have a cancer, you have 6 months to live. You don't say that in many countries. The family would not allow that. Those are the things that you should talk to the husband or to someone else, you know. And the culture would dictate that the patient should not know, so that the patient will feel more peaceful, more comfortable, and let the family members care for it.
In Somali culture, based on their religion, smoking or using alcohol, it's prohibited. And when the providers are doing history and physicals, some of the questions that come up is, do you do street drugs? Do you smoke? Do you drink alcohol? And when you ask such a question to a 60-year-old patient, he or she will be offended. What makes you think that I drink? No. So we tell them in advance. And I'm glad to say that most of the providers in my hospital are actually now aware of that, and they do some kind of, advanced apology.
And language interpreting world is totally different because it falls under the Disability Act. And so there's a lot more regulation, I guess. You can't just walk off the street bilingual and happen to get hired by an agency and then suddenly be interpreting in a hospital emergency room, which you kind of, it's changing now, but you kind of can. I think there, especially with languages other than Spanish, it's really hard to evaluate somebody's proficiency in another language. Who are you going to have as the expert that's going to say, yes, this person is proficient and knows all the medical terminology in both languages?
Just put yourself in the shoes of an immigrant who came to the United States, who speaks no English and who needs medical attention. Suppose you become an immigrant and you go to China one day and you need medical attention. What do you think? You would need an interpreter. That's my point. So probably if we can look from that perspective, that this person is needy because he's new in the country and he needs medical attention, and it's the right of everybody to get medical attention when they need.
They're just like any of us. So put yourself in their shoes. You would have moved here illegally from your country if you couldn't provide for your children. And you would do what you can to give your children a better life. And I think that too much here, we think that we deserve everything that we have. And so if somebody else has a bump along the way, it must be their fault for some reason. I don't know if that makes sense. But I think that we should care just because it's the human thing to do.
We have to be there for our kids. So, there are so many things in there that, make us say we cannot be living isolatedly and separately and say these things do not concern me, no matter what you do.